In its final score, the Congressional Budget Office anticipates that 10 million Americans will lose their access to Medicaid, which opponents of the bill have not been slow to seize upon as evidence that they will lose their access to health care altogether.
The GOP tax scam represents the largest assault on health care in American history.
Now, this commentary is completely irresponsible for a number of reasons. The first of which is that there are approximately 12 million people on Medicaid right now who are not eligible for Medicaid because of the Biden administration's stat padding and roll at any cost approach to Medicaid. This was their border policy just transmuted into healthcare. And with the same exact logic, there's no crisis if you stop checking. A quarter of the estimated drop comes from the sunsetting of a Biden-era COVID credit that was just going to sunset anyway. This is the exact same gimmick that I talked about in the show 2 days ago with the TCJA extensions, pretending that an expiring law doesn't expire because it pads the stats in whatever way you find politically expedient. I should have mentioned when we talked about it, the Republicans didn't cook that up in a lab just for TCJA. Also, nearly a third of the estimated shortfall comes from people who could but won't meet the basic work or community engagement requirements in order to access the bill. Now, you could say that those people should be able to access it anyway, but by far the majority of Americans think that work requirements for government aid makes sense. You should not be able to freeload off the government. This is not reviving the old thing about welfare queens or whatever from the 1980s. This is just a fact that a number of people have access to this program who in most Americans' mind shouldn't have it. And given that we can't afford it anyways, that seems like a reasonable place to cut. And basically everybody else will be able to access healthcare coverage through either employer-sponsored healthcare because they're working or through one of the exchanges of the Affordable Care Act. That is the thing that people are willfully keeping from you. When they catastrophize about the number of people losing health care, they want you to confuse losing Medicaid access that may or may not actually be theirs rightfully by law anyway with losing health care. They are not the same. The issue is framed as an issue of cruelty, when in fact it's an issue of craven statistical manipulation in order to win a political fight. And often enough, it works. This stuff becomes existential to people who then will find themselves justifying, say, robbing a young child of its father if he happens to be the reason that you think people will die. Now, the Congressional Budget Office doesn't get into this.